There's the mic.
Okay.
There's the timer. There's the box.
All right. Hi, I'm Shruti Kothari. I work for Kaiser Permanente Ventures. I lead the strategic engagement program for Ventures. So today's presentation is mainly going to focus on our strategic engagement program that I lead, but I am going to give you a little bit of background on the fund as well. And just as a background on who I am, so my background is really rooted in operations and quality. I started off as a health educator in medically underserved communities, and I went on to work in quality improvement, looking at outcome HEDIS measures and looking at disparities in racial ethnic groups of outcomes and closing the gaps. And then I was the national lead for Kaiser Permanente for home health, hospice, home-based palliative care experience. So basically working on a program that provides over 1 million visits a year in Oregon, Washington, California, and Hawaii. I also worked at Honor. I was one of their first employees, I think 7 or 8 or something like that, and helped develop the products and launched all our new markets. And now I'm at KP Ventures. So 2 big goals, KP Ventures, like most venture funds, generate attractive returns for KP. We invest on behalf of the medical groups and also the health plans, so both, and also to advance innovation. So really looking at technology and services that are meaningful for our members and operations. So where strategic engagement, where that lies, is really about advancing innovation. So I'll talk about the program and what we're doing around them and examples of how we are advancing innovation. We started in the 90s. We've invested or committed over $400 million, and currently we have 33 active portfolio companies. And I think about 70% of those actually have some kind of partnership with Kaiser Permanente. They can be widespread, like for example, Video, VIDYO, which is our virtual care platform, or they can be, in a few regions, a few hospitals, or just in pilot stage. Oh, I should also mention, we invest in everything except for biopharma. So the fact that we have a venture fund is not unique. There are many leading health systems that have venture funds, as most of you probably already know. And we're actually partners with a lot of them. We're very friendly, and we like to be invested in the things that they're also invested in. And so what is different about us is our strategic engagement program. It's rare to find the robust program that we have at other firms. And this was also our first year doing it. So before I came into this role, the program didn't exist. I've been doing it for a year. So a lot of the work I'll be going over was just launched this past year, and we are going to keep adding to our portfolio work in it. So 3 big buckets, and I'll go over all 3 of them and provide examples, but really what's in here is about KP alignment, portfolio development, and then basically being a conduit between KP and innovation. So for KP alignment, this is really about better understanding the evolving needs and trends for Kaiser Permanente, and then matching that with our investment themes, essentially. So I work very closely with all of our leading investors at the firm as well. So an example of work around this, we do a needs assessment. We launched it this past year. We interviewed over 25 leaders across Kaiser Permanente, all executives, so around like the COO level of the health plan, the medical group, and an IT or innovation leader in each of our regions, and again, national office. So folks who are high level but own budget and make the decisions on where the budget goes. So our questions were around, what are your priorities? What are the mission critical things you're looking to solve? And where are you looking externally to partner on technology and services in the next 3 to 5 years, essentially? And of course, there were themes that emerged from that, and that we've completed the needs assessment, and now we're in the process of essentially figuring out how do we align that with our investment themes and as we look for companies. Some pictures down there just of some of the leaders in some of the regions. The next is portfolio development. So this is the 33 companies with the over 50% that have some kind of partnership. This is essentially driving greater collaboration, awareness, and mutually beneficial relationships between Kaiser Permanente and our portfolio. So some examples of these things. So like, for example, this happens a lot where in our partnerships that might only be in a region or 2 regions or a few hospitals, you'll have a champion who's had great outcomes using the company and really wants to talk to like-minded folks within Kaiser Permanente to spread and bring success to scale at a program-wide national sort of level. So we've worked to connect these folks with other people within KP who have similar jobs, to educate them on what they're doing. We have a lot of communities of practice, interregional steering committees, so we'll work to kind of connect. Next, KP leader wants a product to better meet KP needs. So this is as KP looks to their roadmap and they're building out, for example, virtual care and they want different functions. They want to make sure that the vendor is also working to include that in their roadmap of product. So we'll facilitate product development discussions. All of our investors also sit on they're either board observers or sit on the boards of all our companies. So we're also able to advocate at the board level for KP's needs, which is also great for our companies because it may be that Kaiser is their largest healthcare client. And so hearing the needs of Kaiser and where KP is going is helpful for them in general product development for the healthcare market as well. The last, portfolio company wants to better understand KP needs. So this happens a lot when a company isn't in KP or has like maybe a pilot or whatever it might be. So we'll work for a portfolio to understand what questions they have to better understand KP, to better build products or essentially enter the market. And either we will find the subject matter with experts within KP, collect that information, and then give to our portfolio companies, or we'll connect our portfolio with the subject matter experts so they can speak with them and learn more. So things like, what is KP doing around COPD population management? What are some innovative things? Where are they looking to build? Or behavioral health, what are the goals that they're measured on? We want to make sure that as we do our studies, that we also are measuring some of those same things. So the last area, connect KP with innovation. So this is, and I'll preface this with saying that there are many, Kaiser Permanente is a large organization. There are many innovation arms within KP. How the ventures group is different, or its vantage point is unique in that we are a venture fund. So by the nature of what we have to do, we have to see thousands of companies a year. We have to know who the players are. We have to align our themes with what KP is looking for. And then we do diligence right on those companies. And so we know who are some of the good ones we may not have invested in, but are still really great companies with really great products. So there's a lot of knowledge there that sits there. And so it's basically being a conduit between that and then the clinical and operational folks who are making the decisions in everyday sort of care delivery. And so, we already do that for our portfolio, but this is sort of, we do it for our non-portfolio as well when relevant and as the needs are coming up through Kaiser Permanente. So some examples of this is, and I'll start from the bottom up. Oftentimes when KP is looking to build a new strategy for initiative or looking out, they'll have vision and design sessions. Well, they'll invite subject matter experts throughout the organization to come and kind of sit in and provide their insights. And so KP Ventures often has a seat at that table. So we get to hear about what are all the leaders saying, where would they like to go, and then also offer where we see the innovation community is going, what we see being developed and so on. Second, we have leaders that come to us, especially given the KP needs assessment. We talked to over 25 executive leaders. So now folks are coming to us saying, hey, we're looking for a vendor in real time for XYZ. Have you seen companies in this space? Who do you think is a good company? So we'll also connect to innovative companies, generally speaking. Sometimes they're a portfolio plus other companies. Sometimes it's just other companies because we don't have portfolio companies necessarily in that space. And we always let the subject matter expert, the clinical operational lead, make the decision on which company. We'll give them lots of different choices. And the last one is, so again, we have this great, as the ventures program for Kaiser Permanente, we sit in the innovation world, but we also sit in the healthcare world at one of the largest healthcare systems. So how do we bring our perspective to the folks who are building products, who are the innovative minds? So we partner with Rock Health on the KP Venture Speaker Series. So it's every quarter, and we bring an executive leader at the Rock Health offices, and they talk about what they're doing in a certain space and where, as they're looking out, is opportunity to build and partner with external folks. So here's some examples. Dr. Nirav Shah, who was the COO of Southern California's health plan at the time, talked about innovation in delivery of care in the home and what they're doing right now and what the gaps are and where they'd be looking for external partnerships. And Dr. Rahul Rastogi is the CEO of the Northwest Permanente Medical Group. He talked about the virtualization of care. Dr. Rastogi is a kind of a leader in virtual care, has talked nationally about it. So he talked about some of the innovative things they're doing in the Northwest currently, and then how they are looking to build out and where, again, the innovation community can help build. Most of the audience at these events are entrepreneurs, about 50%. We have some venture folks that also come. And some healthcare as well. So I went over a bunch of stuff of what we do, that's great. Just a few things of what we don't do. So we don't do contract negotiations, or we don't make procurement decisions. Some strategic funds like Dignity or even a Providence, they tie their venture investment to operations. We don't. We always loop in KP as far as when we're doing diligence and subject matter experts, and we make decisions based on their feedback, and that's why 70% of our companies have some kind of partnership with KP, but we're not the ones actually making that partnership. So just because we invest in a company does not mean that they get an operational partnership with Kaiser Permanente. And we don't serve the interests of external parties relative to KP's needs. I say this because we definitely are a conduit of innovation within KP, connecting folks to companies when needed, but it's really based on KP. When KP tells us we're looking for a company in XYZ space, then we'll let them know, we'll connect with the companies. But really we're serving Kaiser Permanente's interests. I think that's it.
Or do you guys, is there a particular stage that you want the company?
Yeah, we're usually post, like Series B, post-Series B, so a little bit more mature. Yeah.
Do you guys have any initiatives around the EHR space and the fact that 50% of a doctor's time is spent documenting versus treating?
Yeah, absolutely. That's one of the themes that came up in our needs assessment. It was one of looking at, there's physician burnout, and documentation is a huge part of it. Most of our regions still use like people scribes. So there's a lot of opportunity in that space. So there are regions piloting and testing different things, and also talking to companies like Augmetics, things like that.
Where do you find your company? You mentioned some things as far as you match them up with Kaiser. Do you use at all the Kaiser Permanente supplier database when you find some of your companies, or how do the companies?
Yeah, so we have 3 lead investors, 2 junior investors, and they do the sourcing of companies. They're much like kind of regular venture funds. They're out there meeting people, but we do see thousands, 1,000 probably companies a year. So there's a lot of companies just from what they talk, and so they'll have initial meetings, vet further in the diligence process, and according to that, essentially, we'll connect people with companies that we've met with. I also have a network of venture folks that I reach out to as well. So we have our internal Kaiser Permanente investors that will provide names, and then I have folks at other firms that I'll reach out to and ask for company names as well.
Where is your culture settle on return on investment horizons? So if you have Sand Hill Road and they want ROI in 90 days, and you got corporate venture, which is a little more patient. And where would you fit on the spectrum?
Yeah, I don't 100% know the answer to that question.
Yeah, a patient long-term view, patient as in non-medical,
Yeah.
financial horizon, return of
Well, so our return is 2 to 3 times is what we aim for. But am I answering your question? Is that what?
You're looking for a payback, right? So medically, if clinical tests by nature of complexity of the market is longer term. So it sounds like you're emulating sort of the private venture community, and you're even closely tied to them. So you're probably looking,
Yeah.
for a similar horizon. Thank you.
Yeah.
Could you talk a little bit more about the themes and on your needs assessment, what came out?
Yeah, so we're actually talking, I will tell you some things, but we're also going to be doing things with that information in terms of, there's this internal conference at Kaiser Permanente called the National Quality Conference. We'll be presenting a lot of this information, but we're thinking about doing something for external folks as well and sharing that information. But I'll just name 2 big ones that came up. The virtual front door is probably the biggest one. We're looking to move more and more care out of brick and mortar into, virtual, whether it be chat, text, video, whatever it might be. So there's a whole host of opportunities there, not just in the actual, the tools to do it, but even things like triaging and the whole market, because of the rise in high deductible patients, more and more people are choosing not to go in because they don't want to pay their fees, their copays. So also looking at as an organization, not just us, a lot of organizations are of how do you price these things? What do you price for texting? What do you price for chatting? Whatever it might be. So there's a lot of opportunity in that space in general. Care experience is another one. For some of the same reasons. So it's like this Amazon effect, rising consumerism, but also those folks that are high deductible, right? They're going to be a little bit, they're paying more for what they're getting. So they really, show me that you know me, show me that like it was worth the money that I'm paying to be here. So there's that whole piece to it, and there's also just the lack of data, generally speaking. The CAPS, which are the publicly reported outcomes, which all healthcare systems usually use to measure care experience, are delayed, and they're not specific enough as far as information, and they don't even really measure like your physician experience at all. So there's a lot of issues with that. So there's not good data out there either. Yeah.
So what are the different innovation centers that you have in KP overall? I mean, you're the ventures group, but there are other innovation groups within the system.
Yeah, there's
Talk about
tons.
that.
Yeah, there's lots. Really, there's tons. And so it depends on if you're looking at national, if you're looking at regional. The good part about our group is that we actually work with most of them. But to name a few, you have folks that work in like national IT in innovation groups. You have folks who work for the CTO's office who work in innovation. And then you have folks like in Southern Cal on the medical group side who have a whole innovation center down in Orange County, or the Garfield Center, which is in San Leandro. So, just a little bit there, but there's tons. Yeah.
It gets confusing
Yeah.
for entrepreneurs.
Right, it is. And I would say the best piece of advice that I have is if you're looking for an operational partnership, you should go to operational leader. Like starting with a research group, starting with an innovation group is probably not your best bet if you're looking for an operational partnership. Yeah.
So since you're an IDN, can you talk about quality and how it relates to like how you're looking at innovation compared to maybe how somebody else who's not an IDN, just a provider or just a payer might be looking at innovation?
Sorry, say it one more time.
Since Kaiser's an IDN,
Oh, okay.
Payer and provider, they might be looking at innovation in a different way than say just a provider or
Yeah,
just
sure.
a payer.
Yeah, I mean, the cost and the incentives are completely different for us, right? Like, we make money when our people are not going to the hospital, right? So it's in our best interest for our patients to be as healthy as possible, and we also keep our patients over a long time, right? That whole, we are the health insurance and also the provider, so your care experience is all together. It's not just my experience with my doctor, it's my experience with when I call membership services, my experience when I call. So as far as innovation, really, I mean, the great thing is that the whole world is sort of your oyster, right? In terms of you have all the players together, and if you really want to make impactful change, what other place to do it than Kaiser Permanente? So when we look also at investments, we're looking at investments that impact both health plan and also providers, which is again different if you, from the slide of the health systems, for those that aren't integrated systems, right? So it's completely different, but yeah.
Is there any regional expansion?
You mean acquiring different regions? So Washington, KP Washington is our newest region, and they're always looking for different things, but nothing on the horizon, I would say. I think that KP Washington, we're getting them integrated into KP's system right now. Yeah.
So do you have any kind of exclusive with the startups, so versus then also expanding out to other competitors? So when you invest in the startups, do you have any kind of exclusives or kind of limitation terms, so they don't?
Yes, we don't invest in other competing startups once we invest, yeah.
I think his question was the other way. Do you allow your startups to go to competing healthcare
Oh yeah, of course, yes. And that's another reason why we don't make procurement decisions and contract negotiations, right? Because we want them to expand their business and go. And part of that, where we're friendly with other venture funds, is about that too. So like Providence, we know the team there really well. And so once they invest in a company and decide to put something into operations, we're immediately looking at what they're doing for that reason. But yeah, it's very friendly. It's different. And my background's not in venture, so again, operations and quality. But it's, from what I've heard the investors say, that it's definitely a very friendly atmosphere, the healthcare venture space, and people are really partnering with one another.